So let's go back to that story. The Health Secretary has held constructive talks with the nursing unions. He attempts to avert a devastating wave of winter strikes. Steve Barclay met with Pat Cullen, the head of the Royal College of Nursing, yesterday. The union is demanding a 17.6% pay rise to call off the walkouts. Meanwhile, the biggest health union is beginning to ballot its members in England, Wales and Northern Ireland on strike action. Unison is asking 350,000 NHS staff, including porters, nurses, paramedics and cleaners, to vote in favour of walking out in a dispute over pay. Claire Williams is National Secretary for Unison. Afternoon to you, Claire. Just give us a bit of background on this. Is it broadly the same contention as your colleagues in the Royal College of Nursing are having? Same deal, same demand?
Yeah, afternoon. So Unison is very clear that the pay that NHS staff have been given, which was £1,400, which equates to approximately 72 pence an hour, is just nowhere near enough. You know, that's been swallowed up by inflation, the cost of living crisis. What Unison is asking for is for the government to come to the table so we can sit down, Unison and other health unions, and have some proper discussions about a much more reasonable pay offer. And, you know, Unison's position is we want to have discussions that are much more looking at a pay offer that is in line with that cost of living crisis.
So that would take you above 10%. That's a massive pay rise, surely, Claire?
Well, I've not put an absolute figure on it because I think that's for the negotiators to do with government. But what we're very clear about is that 72 pence an hour is completely unacceptable. NHS staff are leaving at an alarming rate. There is an acute retention and recruitment crisis. There are over 135,000 vacancies, and key to starting to invest in the NHS and to retain and recruit staff is for the government to come and talk to us about, addressing the pay issues. Look, we've got a significant number of NHS employers are now setting up food banks for NHS staff. Things cannot go on as they are. Dedicated health staff don't want to have to go on strike, but really feel they've been left with no option because there is a pay issue and there's an acute staffing shortage.
There is. I mean, it's going to be tricky, isn't it? Because the government would have to find this money from somewhere, presumably. That's taxpayers' money. That's taxpayers who are perhaps not even enjoying the possibility of a pay rise themselves. We're in a cost of living crisis, Claire. How could anyone, whether it's yours or any other organisation, justify such heady demands of, a minimum of 10%, in case of the nurses, 17.6%?
Well, what Unison is asking for is negotiations.
But that's going to be the ballpark you're in, isn't it?
Well, no, what I'm saying is that Unison's position is that we want a pay rise that's much more in line with the cost of living crisis. The reality is that year on year, NHS staff's wages have not been keeping up with inflation. And what we see is NHS staff actually relying now on food banks that are being set up by their employer.
I mean, that's not a typical scenario, is it? That people are using food banks.
It is a typical scenario.
Some people might be using food banks, but essentially you are kind of making that bit up, Claire, aren't you?
I don't make anything up. It's
well, I think you just did.
Well, I didn't make it up because actually NHS employers themselves are publishing that many of their hospitals are having to set up food banks. The second point I'd make in relation to your comment about some people not getting pay rises, part of what the staffing shortage is that NHS staff are leaving the NHS to go and work in other sectors such as supermarkets, hospitality, where those people have been given, in some cases, second and third pay rises because of inflation. So it is not correct for you to say that NHS staff are asking for something that other people haven't.
No, I'm not suggesting. Listen,
the evidence is that NHS pay is not kept in line with inflation, and
neither
the government
I don't know anybody
this issue.
I don't know anybody who's currently got a 10% pay rise.
So, well, there are people getting more than 72 pence an hour outside of the NHS. But the key issue is that there is an acute staffing shortage within the NHS, and key to resolving that, so stopping experienced staff leaving and being able to recruit new staff, we have to sit down with the government and they need to acknowledge and address the staffing issues. And key to that is the level of pay. Isn't
there a point, though, where a kind of a realistic assessment has to be done? And even if somebody sympathises, if you said to me, do I want to pay a porter or a cleaner or a paramedic more money? The answer is obviously yes, that would be great. And I'd like to pay lots of people more money. There is an irredeemable reality, though, Claire, and that is that we're in a cost of living crisis. The government is pretty much broke right now. There isn't a lot of money around. It's a great opportunity for unions to all ride on the coattails of each other and make this more about an anti-Tory thing than it is about a pro-worker thing.
So I think there's the irredeemable facts are that NHS staff didn't crash the economy. I think NHS staff went to work during the pandemic. The government has underfunded the NHS. There's over 7 million people currently on waiting lists. The NHS is in a dire strait. The government needs a strategy, and key to that is investment in the NHS and investment in the staff who deliver those services.
That sounds like an anti-Tory thing, though, talking about crashing the economy. I mean, there's a global issue going on here.
Well, the reality is that it was the previous Prime Minister and Chancellor that took financial decisions that have created an acute economic crisis at the minute. The longer-term issue is that year on year, the NHS is underfunded. We've got an acute staffing shortage, as I've said. We're losing experienced staff at an alarming rate. The ability to recruit staff has dropped, and we need a government to come and talk to Unison and other health unions and organisations about how we invest in the NHS and how we tackle these issues. And that is their responsibility.
This will cost billions. Where are they going to get it from?
Well, the reality is, also, you've said, well, it's taxpayers' money. Public service workers do pay taxes through their wages. There's also quite a lot of evidence that if you invest in public services, you actually help to grow local and regional economies. So I don't think it's correct to sort of pose, well, if we invest in public services, how are we going to pay for other things? The two things are connected. But the reality that we're talking about here is NHS staff are using food banks, employers are setting up food banks, and their pay is not adequate enough for them to be able to pay their wages.
Listen, nobody suggested there aren't some people who happen to work for the NHS that have used a food bank, but the idea that this is industrial scale, that the average paramedic or nurse is using a food bank, is simply not true. You're using that as a device, aren't you, to almost convince people that this situation is more acute than perhaps it actually is.
So, well, I don't need to use anything as a device, because what I'm giving you are facts and evidence. When you've got NHS providers and employers themselves saying that, when you've got NHS employers and providers themselves saying they are really exceptionally concerned about the acute staffing crisis in the NHS, I think it is, incumbent on the government to be responsible, to listen to that and to come and meet with Unison and other health unions to look at how we can resolve these issues.
So what's the deal now then? When or if would strike action happen? What's the assessment
So
there?
Unison's ballot is underway at the minute. As you've said, 350,000 NHS staff are currently being balloted by Unison. Our ballot ends on the 25th of November. At that point, we will know the result. I think the important thing to reiterate again is NHS staff are really dedicated. They don't want to have to go on strike, but the situation's so dire, they feel they've had no alternative but to be balloted. A strike isn't inevitable. The government needs to come and sit at the table with Unison and other health unions and look at negotiating a way through this. A crisis can be averted, but actually the responsibility for that sits with the government wanting to engage and come and discuss and negotiate.
Claire Williams, thank you, National Secretary of Unison.